Health activists are concerned that public health has long been underfunded throughout the country, to such an extent that 1 in 2 Ugandans seeking medical treatment must use private instead of public hospitals. Early this year, the breakdown of a cancer radiotherapy machine at the National Referral Hospital in Mulago irked sections of the public who lashed out at the government for neglecting the health sector.
So, managing the wider health system issues of human resource is extremely important. How many human resources do we have to manage cancer?
Cancer before the age of 75 is around about 17.8%. And in the next 5 years, it's estimated that we shall be having 300,000 cancer cases in the country at any one time. Currently, less than 5%, about 4% of the new cases in the whole country are seen at the Uganda Cancer Institute. The rest of the patients being condemned to death all over the countryside.
This, among other challenges such as remuneration of health workers and welfare, are still plaguing the sector, and most recently a strike by medical assistants at Mulago Hospital.
Mulago right now we are around 70 doctors and then 32 pharmacists, and then nurses are around 30 doing their internship. And we were last paid last year, December. And then we got actually they paid it once. They paid in November, October and November, and then we received that money in January this year. So since then we have not been paid.
According to the World Health Organization, even in areas where Uganda's health system used to excel, the country is now struggling. In spite of once being a public health success story for its ABC prevention work against HIV, AIDS, which is abstain, be faithful, use condoms, Uganda now has the same number of people living with the disease as the United States, 1.2 million. The country has been criticized for allocating too little of its own money towards the disease, even as international funding is shrinking. Uganda has 34 million people, and according to the Ministry of Health, there is one doctor to every 300,000 people.
In the next financial year, focus will be placed on accelerating interventions to improve availability of healthcare workers at health centers and enhancing maternal, newborn and child health in order to reduce the high number of deaths.
Sub-Saharan Africa is still the riskiest region in the world for a woman to give birth. Uganda accounts for 2% of annual maternal deaths globally. Uganda Demographic Health Service says maternal mortality has reduced. However, this change is not statistically significant. The Ministry of Health figures show that Uganda currently has the 6th highest number of annual deaths from malaria in Africa and some of the highest reported malaria transmission rates in the world. Malaria remains a major killer of children, particularly in sub-Saharan Africa, taking the life of a child every 2 minutes. In 2015, there were 438,000 deaths from malaria globally, and about 306,000 of these were in children under 5 years of age. The government recently announced the third mass mosquito net distribution drive. A total of 25 million mosquito nets worth some 331 billion shillings will be distributed in the Fresh Countrywide campaign against malaria. This sounds commendable to the ears, but the actual results are yet to be realized.
Since we moved away from chloroquine and fancida to what we call artemisinin combination therapies, they are very effective. We have introduced also indoor spraying. Okay, so what is the problem at the moment is we are not implementing these actions to full scale. If we implement them to full scale, have over 90% coverage, we can bring malaria down to pre-elimination levels, and that is the goal of the ministry. When we reach